Good morning. Good morning, Representative Walker, Senator Austin, Representative Nucci, Senator Summers, and members of the committee. My name is Mark Schaefer, Vice President, System Innovation and Financing at the Connecticut Hospital Association. I appreciate the opportunity to testify concerning House Bill 7254, an act concerning the Department of Social Services implementation of changes resulting from the Medicaid rate study. CHA supports the intent of this bill, which is to address the significant Medicaid underfunding across the healthcare continuum, such as you just heard, for example, about Oak Hill. As we've previously testified, Connecticut substantially underinvests in Medicaid relative to other northeastern states. We would spend $2.5 billion more a year on Medicaid if our spend was in line with these other states. This is consistent with the marked underpayment found in the recent DSS reimbursement studies. However, we think it's important to note that the Phase 2 study released in January failed to document the substantial hospital underpayment that exists today in Medicaid. Connecticut hospitals are reimbursed less than 60 cents on the dollar for the services provided to Medicaid beneficiaries after accounting for the taxes they pay to fund the state share of Medicaid services. The hospital operating shortfall has grown sharply in recent years, reaching $1.4 billion statewide in FY 2023. According to a recent Office of Health Strategy report, the Medicaid hospital shortfall in Connecticut is 79% higher than the national average. It is critically important to address this issue. We strongly encourage the legislature to include hospital increases as part of this proposal. We believe that such increases could be enabled by a comprehensive redesign of the Medicaid program, one that could include better use of Connecticut's hospital tax program to advance the important public policy goals that the legislature set forth in Section 17, Public Act 23-171. These goals include addressing social, economic, and environmental drivers of health, improving the long-term health and well-being of individuals enrolled in Medicaid, and promoting affordability for all. There are two elements that are critical to this Medicaid redesign that I'd like to call out before closing. The first is that we believe the hospital tax, in combination with other sources of revenue, should be used to reduce or eliminate the shortfall and provide for annual updates. Second, we believe that a new payment model is needed, one that capitalizes on the role that multi-sector health partnerships can play in addressing the root cause drivers of poor health. We recommend a financing and accountability framework that provides new investment funding for hospitals and their multi-sector partners to invest in place-based health initiatives. We also recommend that 100% of the resulting savings be shared for reinvestment back into the communities. We welcome the opportunity to engage further on a comprehensive solution that will support the cost of care delivery and drive better health and affordability for all. Thank you.
Thank you, Mark. Thank you for your testimony. I know we are all trying to work through the hospital plan that we have to create with the state of Connecticut, and I think it's going to take us a little while, so I hope we get to it soon. Thank you.
Thank you.
Thank you. Any questions, any comments? No? Thank you, and have
Thanks
a good
so
day.
much. You too.
Next.